If you are wondering what it's like to live with a new kidney, then let me break it down for you. If you are new here, 10 years ago I was diagnosed with chronic kidney disease, and after years of medication just to manage the condition, I needed to have an urgent transplant. That one took another year to achieve, but I stayed alive with the help of dialysis. It's been 3 years since the transplant, and this is what it feels like to live with a new kidney. First, I take 2 categories of medication. The first category is the immunosuppressant, also called anti-rejection medication, while the other one is for hypertension. If you don't know, kidney disease and hypertension are not always far apart. They sort of go hand in hand. Now, this is what is funny about immunosuppressants. Like I said, they're also called anti-rejection meds and are basically meant to weaken my immune system so that my immune system will not have the strength to fight the new kidney. Let me explain. That's because the immune system views the new kidney as a foreign entity, an alien, something that should not be part of my body system. Now, without a strong immune system, I have to be extra careful of my environment and make hygiene my top priority, because we are weakening the defenses of what is supposed to keep my health safe. That is to ensure that the foreign organ remains welcome in my body. Now, here's what happens if a kidney transplant patient begins to skip use of medications frequently. That patient's immune system becomes strong gradually and will start attacking that foreign organ. That means there's a possibility that the kidney disease will return. You get how these things be sometimes. Now, here are a few of the things that I stay away from due to my condition. Number 1, grapefruit. That's because they can spike the level of immunosuppressants in the body, which is very dangerous. Immunosuppressants are not supposed to be too high or too low. They just need to be regulated to a particular amount. Also, there's processed sugar, the one in soft drinks. Then there's alcohol, smoking, and salt, which is essentially for hypertension. No, I stay away from salt because of hypertension. Now, how often do I visit the doctor's office? Well, my follow-up sessions have usually been between 2 to 3 months. And they basically do blood work, urine tests, vital tests, and so on, just to check the effectiveness and how well the kidney is functioning. This will help them decide when or if they should increase or reduce my dosage. And lucky for me, my dosage has always been reduced. Well, it has been reduced a couple of times, which is good. Does this mean a day will come when I can stop using those medications? That's a bit dicey. What I've always known is that I'll be on these medications for the rest of my life. Now, there are confirmed cases where patients have had their medications reduced to the barest minimum, and also some unconfirmed cases of people who are taken off their medications totally. That I am not sure of. But what I know is that I will continue to do what the doctor says. Thank you for watching. This is how I live my life as a kidney transplant patient. I'll see you in the next one.